Thank you. Firstly, I'd like to thank Paul House for his beautiful welcome to country. I too would like to acknowledge the traditional custodians on the land we meet and pay my respects to their elders past and present, but also pay my respects to the elders and future leaders of Aboriginal and Torres Strait Islander people that are represented here today. Thank you. Distinguished guests, Commissioner McGooda, Minister Nash, our partner organisations and those present who are here to commit to close the gap. Thank you all for joining us today and showing your support. Now, I know I'm going to get in a little bit of trouble, but I'm going to ad-lib here. You know, we've used really nice big words, but we need to bring it back to, we talk about difference in life expectancy. That means we get to spend an extra Mother's Day with our mothers, or we get to spend an extra day with our children, or we get to send our children to school. They're the real reasons that we're here. It's great to use big words, but they're what drives Aboriginal and Torres Strait Islander people and other people who are committed to close the gap. So as Chairperson of Indigenous Allied Health Australia, I am very proud to be signing this intent between our organisations, the National Aboriginal and Torres Strait Islander Allied Health Peak Body and Allied Health Professions Australia, its member organisations and its affiliates. We all know that gains in health, education and employment outcomes, life expectancy and other measures of life improvement for Aboriginal and Torres Strait Islander peoples can only be achieved when we work together. Our membership has grown by over 50% in just the last 8 months. That is in recognition of not just the support that people provide, but the recognition that people want to be working in this space. So we are made up of allied health students and graduates, as well as the strong associate members of those that want to partner with us and work with us in true relationships. IAHA embraces a holistic and inclusive approach towards meeting the complex healthcare needs of Aboriginal and Torres Strait Islander people. It is inclusive in a broader scope of allied health professions as we determine the meaning of allied health from an Aboriginal and Torres Strait Islander perspective, what that means for us to be working in the allied health space. We support our membership as a collective, providing national allied health leadership, and thank you to Mick for the kind words, advocacy and support across a number of sectors, particularly health and education. But if you don't have health and good education, then you can't go to meaningful employment. So, this is really the pillars that hold our communities together. We strive to support and build a strong Aboriginal and Torres Strait Islander allied health workforce and to influence the cultural responsiveness of the wider health workforce in general. We advocate for sustainable workforce development and strategies that promote the diversity of choice to Aboriginal and Torres Strait Islander people considering careers in health, because we need them in everything. Underpinning this work is the notion of the human rights-based approach to health, including equitable access to allied health services, which are appropriate, available, acceptable and affordable. Health is not a privilege, it is a right. In doing this, we recognise and value the uniqueness and the diversity of allied health professions impacting on the delivery of health services to Aboriginal and Torres Strait Islander peoples and their communities. IAHA does not seek to duplicate, but rather collaborate with our partners and stakeholders. We value and add to the existing professional and personal support structures from a culturally responsive way. One of the things that I say is that the workforce that gets Aboriginal and Torres Strait Islander people gets that with the worldview lens that they come to it from. So today is a historic moment in the health sector for Australia. It is worth taking a moment to reflect on the significant first step, the fact that AHPA and all of its 22 member organisations and affiliates have chosen to. We haven't dragged them kicking and screaming to the table. They are here because they have chosen to sign the statement and demonstrate their commitment to working collaboratively with each other, IAHA and other stakeholders, to close the gap. It is not just to stop here though. This is just the beginning of an exciting journey towards increasing access to culturally responsive allied healthcare that includes Aboriginal and Torres Strait Islander allied health professionals. The IAHA understanding of being culturally responsive is multi-layered, but ultimately, as Ian said, it is about an action. It is about responding appropriately to the unique cultural needs of the individual, family, community or organisation that you're working with. IAHA encourages our partners and indeed all Australians to be fearless as we take action and work collaboratively with Aboriginal and Torres Strait Islander peoples, communities and organisations, including IAHA. Just as the original Close the Gap statement of intent, this is a living and an evolving agreement, embracing those who are willing to commit. IAHA would welcome any allied health organisations who are not currently signatories on this statement to consider signing in the future. The more organisations that commit to making a difference, the better. And again, in trouble. Difference is just that, it's different. It's not right, it's not wrong, it's just different. And difference can be good. So embracing difference and how we can make that better for the future. So on behalf of IAHA Board, and I acknowledge the board members that are here, and the members of IAHA who are truly the soul and the reason that IAHA exists, I am proud to sign this statement of intent today. And I look forward to working with our new partners to develop ongoing, realistic and sustainable strategies that will contribute to close the gap. Thank you.